All right, so as far as imaging assessments, x-rays, CT scans, and MRIs can be done. It's important to know that the patient should have colonoscopies at least every 10 years. Um, the EGDs are typically performed over an upper GI series. An upper GI series is when the patient is given contrast through their IV. And there's a series of radiology tests done to detect disorders. The EGD is performed and preferred because it allows direct visualization because a tube is being put down the patient's throat. The surgeon can also stop any bleeding or dilate the esophagus if needed. Now, endoscopy procedures can evaluate bleeding, inflammation, tumors, and cancer. The patient has to be in PO for 6 to 8 hours before the procedure. Patients should avoid anticoagulants for several days before the test. If the patient has dentures, they should be taken out. Versed, Diprivan, and fentanyl are the typical drugs that are given. These drugs can depress the rate and depth of the patient's respirations, so it's important to monitor the patient's vital signs closely. Now, during the test, there's a nurse, an anesthesiologist, and a surgeon. And these patients these individuals are all watching for aspiration, bleeding, and fever. Okay. A local anesthetic can be sprayed on the throat, and it can inactivate the gag reflex. Sometimes this is used, and other times it's not used. Now, these patients will go through pre-op, then they'll go to the surgery, and then they will be post-operative. Now, these patients should not drive for the next full day. Okay, their voices can be hoarse, so hard candies can help, or throat lozenges can help. ERCP, that's performed to view location and the cause of obstructions. Stents can be inserted into any ducts if they need to be opened. Biopsies can be taken. The patient is NPO for 6 to 8 hours. These patients, they can have breakfast. Let's say they can have breakfast at 8 a.m. and then they're supposed to be NPO after 9 a.m. If their surgery is scheduled for 5. IV access is required for the patients that are having the ERCP because the patient will receive drugs in contrast medium. Dentures are removed. Electrocautery is used in the procedure, and that cannot be used with those who have any type of implanted device in the body. Now, colonoscopies examine the large bowel. Those over 50 years of age and older should have a colonoscopy at least every 10 years, or more often if there's a family history or if polyps have been removed. Now, it's important to instruct the patient to cleanse the bowel prior to the test. Go lightly is typically given. They can prescribe laxatives for the patient or enemas. If the bowel is not cleansed properly, visualization of the colon is not adequate. Now, we want to make sure that these individuals are avoiding orange, red, and purple drinks, but we do want them to stay hydrated with Gatorade in order to replace any electrolytes lost. Now, the patient should be NPO for 4 to 6 hours before the procedure. And in any case where we want the patient to be NPO for a procedure, if they are diabetic, they should check with their doctor on what they should do about their drug therapy, okay? Now, the patient will be given Versed, Diprivan, and or fentanyl during the procedure. Air is instilled into the intestine to allow for more visualization. Now, with that air, we have to keep in mind that the patient will most likely experience fullness or cramping or those gas symptoms because of that air that was instilled, and that can occur for several hours after the test. Any excessive abdominal bloating can warrant the patient to go to the hospital if it's associated with severe pain. Okay, with these patients, we have to be cautious of any perforations, so we should instruct the patient that perforation can happen and it will cause severe pain and a rapid drop in blood pressure, which results in from hemorrhage. Now, how should these patients lie whenever they are having a colonoscopy? The patient should be on their left side with their knees up. Now, atropine is kept available in case of a vasovagal response, which can cause a decreased heart rate. If respirations are less than 10 per minute, or if end-tidal CO2 is less than 20%, the nurse should use stimulus in order to achieve adequate respirations for the patient. Now, we do want to instruct these patients that small amounts of blood in the first stool after the procedure are expected if there's been a biopsy or removal of polyps. In the next audio, I will begin with Chapter 53.